good morning. Today we have Dr. Lisa Sharkey, and we have so much to talk about, but I'm going to let her introduce herself. Doctor, please tell us who you are, what you do, and what's your specialty.
Thank you so much for having me, Maria. So my name is Lisa Sharkey. I'm a gastroenterology consultant. I worked at Addenbrooke's Hospital in Cambridge in the UK for 8 years before relocating to Dubai 2 years ago. And I now work at King's College Hospital in Dubai. I specialise in all aspects of luminal gastroenterology, we call it. So things like inflammatory bowel disease, celiac disease, and I'm particularly interested in clinical nutrition and how that influences different conditions.
Amazing, doctor. Well, thank you. Welcome. And welcome to Dubai. He's turning to Dubai. I'm starting it. Yeah. Okay. So let's talk about a particular condition that has been around for quite long, but people still don't know enough about it. And it's Crohn's disease. Yeah. Right? For patients who just got diagnosed and for the people who want to support them, please briefly explain what Crohn's disease is.
Okay, so Crohn's is one of the inflammatory bowel diseases, the other one being ulcerative colitis. It can affect anyone at any age, but we usually diagnose people when they're young adults, so 15 to 30. So that means that you're looking after people at a very vulnerable stage of their life and throughout the rest of their life, because it is a chronic condition.
Okay.
There isn't a cure for it, but there's plenty of treatments that can keep it under control. It can affect any part of the gut. We talk about affecting from mouth to bottom. And it's characterised by inflammation. And I think a lot of the time doctors talk about inflammation and don't really explain to people what they mean. So, for example, if you stub your toe and you shout because it hurts, you'll notice that after that it turns red and it gets a bit swollen and it's painful. And that's your body's inflammatory response to the injury. So inflammation is a process that we need. It's how we repair and heal. But sometimes it gets a bit out of control and goes unchecked. And if that affects the gut, then it gives you an inflammatory bowel disease.
Correct. And that's the thing, I guess, something that you will say is the inflammation, that a lot of people are getting used to it and living with it. But so since we already kind of spoke to that, please explain to us what are the challenges and the journey someone needs to go through in order to be properly diagnosed and get the right treatment.
Sure. There are lots of challenges, sadly. So one of the things we worry about is the delay in diagnosis. Sometimes the symptoms people have can be relatively mild and kind of non-specific. The classic symptoms would be abdominal pain, diarrhea, maybe blood in your stool, and weight loss. But for some people, they don't get that. It can affect your joints, it can affect your eyes, your skin. And sometimes the initial blood tests we do are just slight abnormalities. So it can be difficult to get to the point of diagnosis, and there can be delays getting to the point of diagnosis. And sometimes people have maybe had missed opportunities. You know, they've attended their GP or they've attended the emergency department with symptoms, but the pieces haven't quite fit together and people haven't made the diagnosis. And once the diagnosis is made, then the ultimate decision is how to get you on treatment and what treatment to get you on. Because we know that this is a chronic condition. There are times when the inflammation will be very active, and we call that a flare-up. And then there are times when it will be less active when someone's in remission, their symptoms are less. The aim of treatment is to reduce the chance of you getting a flare-up and keep you in remission as much as possible.
Okay, perfect. Since, like you say, every person may show different symptoms, but which are symptoms that if someone right now is suffering, they definitely come to you or to specialists to seek for help? What are those symptoms that you cannot ignore?
Sure. So definitely abdominal pain that's present very frequently. Diarrhea, particularly if there's blood in the stool as well. If you're losing weight for no reason. And also if you have what we call the systemic symptoms, so fatigue, lethargy, joint aches, difficulty sleeping. Now, of course, some of those symptoms are very non-specific, and just because you have those doesn't mean you necessarily have Crohn's disease or inflammatory bowel disease. But if you have any unexplained symptoms that you're worried about, the message is always, please come forward to your doctor.
Okay, perfect. Good. That's definitely good advice. Make sure they don't continue ignoring symptoms because there are a lot of the treatments. Part of that treatment, how important it is nutrition and lifestyle, someone who is, going or living with Crohn's disease?
It's so important, and I'm so glad you asked that question, Maria, because I talk about this a lot. There's two things to consider. There's how does nutrition and lifestyle affect your chances of getting inflammatory bowel disease, and how does it influence your condition if you have it? So if we take the first one, what factors influence your risk of getting Crohn's disease? There are a couple of really important things. One thing is ultra-processed food, which is around everywhere at the moment. So these are the foods that are very highly processed. They're designed to be very convenient for us. They have a really long shelf life. And they're designed to be really tasty, hyper-palatable, we call it, so that you keep going back for more. But the people who have very high intakes of these foods do have an increased risk of getting inflammatory bowel disease. The other major nutrition thing that I'm always talking about is fibre. Amazing. Most of us are not getting enough fibre. Fibre is so important, and studies have shown that people with lower fibre intakes are at higher risk of getting Crohn's disease. Yeah. So fibre not only provides bulk to your stools, it improves transit through your intestine, and it's actually directly nourishing to the cells that line your colon, which is what you want if you've got inflammation there, isn't it?
Yes.
And then if we think about the factors that influence your disease activity, if you do have inflammatory bowel disease, again, a couple of really important things. Obesity is a big problem, of course, around the world these days, and we know that people with obesity do have more disease activity with Crohn's disease. They're more resistant to certain treatments, and they're at higher risk of complications. So managing that is as important as managing the inflammation in a patient with Crohn's disease and obesity. And of course, they're not the only answer to this, but the GLP-1 drugs that are everywhere at the moment have been used in people with Crohn's disease and shown to be safe. They don't influence the inflammation, they don't cause people to have flare-ups, and they do help people lose weight, which does reduce their risk of future complications. So whilst they're not the only answer to this problem, they can be part of the solution, yeah.
Okay.
And also we need to think about vitamin D and zinc. If you have low levels of these, you're at higher risk of relapse from your Crohn's disease. But we can't leave nutrition and lifestyle without talking about smoking, because smoking is without a doubt the worst thing you can do if you have Crohn's disease. I'm sorry to the smokers out there, but you're 3 times more likely to develop Crohn's disease if you smoke, and you're going to have more relapses, you're going to have higher risk for needing surgery and more complications. So if there's one thing you can do for yourself if you have Crohn's disease and you smoke, you've got to stop.
I said smoking. Okay, perfect. Great advice, doctor. Thank you so much. Okay, so we talk about lifestyle and nutrition management, and obviously there's medication that we need to be involved. Mm-hmm. And now the journey of how the treatment of Crohn's disease has evolved is being great. And now there's the introduction of biosimilars and biologics. Tell us about how is that helping the patients, do the treatments and get a better lifestyle.
Thank you. Yeah, it's really good at the moment. We've got lots of treatment options. So lots of really good science was done to uncover different inflammatory pathways that are involved in Crohn's disease, and that led to different treatment targets. So now we've got biologics that targets lots of different parts of the inflammatory pathway, we call it. And we know that in certain people, one part of that pathway might be more dominant than others, which explains why some people respond to one drug but not to another.
Okay.
And hopefully we're going to get to the point where we can look at you as an individual, what your particular inflammation pathway looks like, and pick the right drug for you. We're not quite there yet, but that's what people are working towards. We'll get there. We're going to. For the moment, we have a new spectrum of biologic drugs, and then within some of those, we now have these biosimilars, which really open up access to a lot of people. It's fantastic innovation. If I'm talking to a patient about a biosimilar, what I'm saying is, look, these were designed to be almost exact replicas of the parent drug, or the reference product, as we call it. They've been tested by the FDA or the EMA, whichever regulatory body is appropriate, and they've been shown to work just as well as the reference product. But because they haven't had to go through all stages of the drug approval process, they are cheaper. And that is going to be important for some people as individuals if they're paying for their own treatment or paying for part of their treatment. But also anything that lowers drug costs in healthcare is good for the whole healthcare system, whether it's a national service or an insurance process. Lower drug costs mean we can get better access to treatments for people, and, it's better for the whole economy.
Okay, yeah, that's definitely something that is definitely helping a lot of people, also the practitioners as well, to get, the patients to get treatment quicker. Tell me, what would you tell to those patients? Because Crohn's disease, there's no cure, right? They need to manage that for the rest of their lives. Yeah. So what would you tell to those patients who are probably a little bit afraid of taking or using medications for a long period of time?
It's always a balance. Any treatment is a balance of risks and benefits. All drugs come with potential side effects, but there's also consequences of not treating things. So we're always balancing in our minds the effectiveness or the efficacy of the drug versus the risk of side effects and toxicities. And it has to be a joint decision. It's not for any doctor to sit and tell a patient, you must go on this medication. It's got to be a joint decision. I'm here to, provide the options, maybe steer someone in a direction if I think a particular drug is more suited to them. But ultimately, I want you as a patient to take your time, read about it, think about it, discuss with your family, and then come back to me and we'll make that decision together.
Okay. Doctor, would you agree saying that the Crohn's disease, the symptoms can be different for every person? Not all medications work for everyone. The lifestyle changes need to be adapted. Would you say that it's a very personalized approach when you're talking to your patients about how they treat it?
It really is. Every journey is different, and that's true for Crohn's disease as well. So there's lots of support available for people, but I think you have to be a little bit cautious where you get your support from. So, the online world, the social media world can be fabulous for many things. But if you're watching something somebody's saying about having Crohn's disease, you have to be aware that not one thing suits everybody, and what's right for them may not be right for you. If you've got any concerns that you're not on the right treatment or your diet isn't what it should be, that's what your healthcare team is there for, to discuss that with you and hopefully alleviate any worries that you have.
Amazing, yeah. Doctor, and what will be the final message you want to give to those patients who are maybe just recently diagnosed with Crohn's disease or who are been living with Crohn's disease for a while? What would be the message that you want to give to them?
Number one is we can never promise people a completely normal life, but we want to work with you to get as normal a life as possible. And many, many people with Crohn's disease do say they have a normal life. We are here to support what's important to you, whether that's travel, your hobbies, having a family, work, study, whatever it is. We want to help you achieve your dreams, I suppose. It's an appropriate thing to say in Dubai, isn't it? But also, if that's not happening, so if you've got ongoing symptoms or worries and you're sitting at home thinking about them, please don't. That's what we're here for. Please come and tell us about them.
Amazing. And we talk about this, that the good thing about the healthcare system, especially here in Dubai, is if you have a specific problem in a part of the body, in this case, your digestive tract, and you don't know exactly, you can go to a specialist right away and seek the help they need.
Yeah, we're really fortunate here, aren't we?
Amazing. Well, Doctor, it's been a pleasure speaking with you.
Thank you.
Thank you so much for sharing your knowledge. Thank you so much for giving so much hope to those people who have this chronic condition. And thank you so much. We're looking forward to seeing you again.
Thank you so much, Maria. Thanks for having me.